Are your supplements really doing anything or just doing damage to your bank account? In this episode, we take a closer look at the vitamins, herbs, and powders so many of us actually rely on. You'll hear what the science says, when supplements might help, and how to steer clear of risky interactions. If you've ever reached for multivitamin, collagen, or turmeric, this one is for you.
Our guest today is Dr. Rashma Patel. Dr. Patel graduated from the University of Texas doctorate program of pharmacy. She's been a practicing pharmacist for over 20 years, and her passion is to help older adults navigate the world of pharmacy and decrease the overuse of medications that can contribute to adverse events and outcomes. She loves to educate and advocate for safe, effective, and minimal treatment to prevent adverse events and keep people healthy at home for as long as possible. Dr. Patel, thank you so much for being on this episode of CareLab.
Ooh, thank you for having me. I'm excited to be back with you, talking on this platform and educating our seniors.
We're here to talk today about something that I find endlessly fascinating, that I think is really controversial amongst people, and that is and we're just kind of going to dig into this big, broad topic, which is supplements. They can be really confusing to know if they're good or bad, what's in them. They're not necessarily regulated. So I'm just going to toss the ball straight to you, Reshma, and say okay, supplements, go.
That's a big topic.
Yeah.
Very big topic.
Yeah.
But yeah, so supplements are a 50 plus billion-dollar industry in the US, which, like you mentioned, is not regulated by the FDA. Um, the FDA does regulate medications. So medications you get over the counter, as well as such as aspirin, ibuprofen, Advil, and then the prescription medications that your doctor prescribes. But the herbal and supplement industry, which is all the vitamins and herbs, are not regulated by the FDA. They do have manufacturing guidelines that they have to follow, but that's it. No safety or efficacy um, for supplements. So it is a big industry out there. 1 in 3 seniors use supplements. So it's widely used and commonly used among seniors. Um, there's a lot of claims made with supplements that's not always accurate. So they can't claim that it cures something or prevents something. So that's an important thing to remember when you are listening to advertisements or commercials or flyers about a supplement, is to remember they can't claim a cure, but they can say it will support or promote gut health or brain health or heart health. Um, so they can say that, which, is very fine line to
Mhm.
say that it's a cure or it's going to help you. And then the other big thing with supplements is um, it's the whole placebo effect as well. So in studies, we've seen that the placebo effect is huge. So 70% of the time, if you think this medication or product is going to help you, 70% could be a placebo. Just because you think
Mhm.
it is. So there's been studies done on that. So remember that as well when you go out to get a supplement, is that we're putting our faith in something that we're not sure what's really in that product. Um, Now, do I feel that supplements are needed? Yes, for sure. Are they overused? Yes. We need to have balance because um, certain medications will make certain vitamins and nutrients in our bodies deficient. So we should remember that and supplement when we can. But what's really happening right now as well in the industry is where we're um, thinking that there's no toxicity. This is a natural product. I can take it. It's not going to interact with my medications. And that's not true. So remembering that if you're on medications, um, supplements are needed. It's very important to talk to a pharmacist or your provider and ask questions because a lot of herbs do have drug interactions with medications. Um, and not only that, but natural products can be harmful when taken in excess or overused at doses that are not recommended. So it's a lot in the supplement industry that still needs fine line, tuning, where we are still, not at a place where we can just say it's safe.
Okay, I have so many questions.
I like
And
I
before I,
can't even keep track of the number of questions
I
that
can't,
I have.
in my
I'm
head, I'm just like, got this and exactly.
Yeah.
So I'm going to start with probably the hardest question first, which is why do we not regulate the our supplements for multiple reasons? Because like all the things you said are kind of complicated. The physicians do prescribe like vitamin D or whatever when they see that it's needed. So it's like part of the regimen. And it could be a lot more, we could know a lot more if it was regimen because we'd have more research and then we'd have more rules. So what is the reasoning that you think that we're not regulating it?
Well, one of the big reasons is lobbyists.
Mm-hmm.
So, unfortunately, right now, there's a lot of lobbyists in the supplement industry that are, you know, not, going behind the fact that it's a natural product and that it shouldn't be harmful. And so we don't need to regulate it. Um, that's the big thing that I'm hearing right now in the industry with supplementations and vitamins and herbs, why they're not regulated more. I think, in the chances of it causing death is very rare, but it happens, like ephedra. It's a supplement, and once they found out that it causes death, they did something about it. But and I feel like our system is reactive more than proactive right now with this topic. We, you know, as I feel like more people are getting educated and what you guys are doing, podcast and giving knowledge to your consumers, we're hopefully going to see a change. But right now, there's so many barriers to regulating supplements.
How important is it for someone who is taking a supplement or thinking about taking a supplement to have a conversation with their doctor and their pharmacist about that?
Huge, huge. We can catch a lot of things when it comes to medication management with supplements and vitamins. And just talking to your pharmacist and provider, letting them know what you're on is huge. People think, and again, that perception that's out in the industry that supplements are safe and it's a natural thing and we have it in our body and it's just adding, because we're depleted right now for a certain reason. So that whole perception of the safety and the naturalness of this product tends to have patients not even mention that at their wellness visit with their physicians. But it's huge because we've seen lots of drug interactions with herbs and medications. And then supplementation, like the vitamins, the nutrients. those is we're checking mainly, are they on a dose that may be toxic for them?
Mhm.
So that's the important thing with the vitamins and nutrients, is making sure they're not on a too high of a dose, or maybe they're not on a supplement because they're on a medication that depletes them of, let's say, B12 or something like that. So it's very important to speak and have a pharmacist or physician look at your medications and review and see what do we need to add, how much do we need to add, is it too much, and is there drug interactions with these medications together?
So on that topic, like, or on that point, one of the things that we hear a lot is you should get all your medications from the same pharmacy as much as you can, so that that pharmacist there, no matter how many doctors you have prescribing, can have one whole list and be like, oh, these things shouldn't be happening.
Hmm.
However, if I'm buying some over the counter something, then my pharmacist doesn't actually know that I'm taking it. Are there any, besides like walking up to the counter, are there any other ways for us to like have an understanding of what is too much or what is too little or what interacts with what?
Yes, that's a great point. Working with the pharmacist at your independent pharmacy or the pharmacy that you get your medications filled at is a great resource. The only problem is they don't have the time to
Yeah.
look deeply into your medication profile. I do highly recommend that all patients fill their medications at one pharmacy and then let their pharmacist know that I'm also taking these supplements, whether they buy it from that pharmacy or Target or anywhere else that doesn't have a pharmacy. Um, but just to let them know. Now, there are pharmacists and groups coming up and that have been in the industry that do medication management for patients. And that's one thing that I do as well, is advocate to get your meds looked at, reach out to a pharmacist or someone that's knowledgeable about medications and drugs and how they should be used, with someone in the industry that has the training and the background and the knowledge to look at those medications and say, okay, this is what you're on and what can we add, or like I said, take away.
Oh, so
So
there is like that's a thing that like if I go to my CVS and they give me my prescription and they say, "Do you have any questions?" There's 30 people behind me and I waited 30 minutes to get this. So I don't feel like I can be like, "Well, let me tell you about all this other stuff and then like tell me about I just doesn't feel right." But you're saying I could come to you or another like I don't want to call it aftermarket, but another pharmacist that's outside of like your pharmacy system and like say, "Here's all my stuff," and like have a consultation. That's like a thing.
yes, exactly. It is a thing, and I think people forget that pharmacists have a lot of knowledge when it comes to their medications. And I think people know that when they go to the store, but when they go back home, they just think to call their physician.
Hmm.
But again, the physician is busy, just like the pharmacist, and you may end up talking to the nurse. And nurses are great resources as well. But when it comes to drug interactions and all of that, like what's the appropriate dose for me, they're not educated or may not know that unless they got educated in that area. So, yes, it is definitely a thing that's happening in the industry right now. There's quite a bit of pharmacists starting to realize the need and the importance of this kind of service for patients and caregivers, because caregivers are the ones who give their mom or dad or whoever it may be their medications, or husband or wife. And it's very confusing, and it can be overwhelming as well. And so yes, a lot of people also tend to go to the internet and look
Hmm.
up things because they're like, oh yeah, the internet will give me an answer, and it will. But you just need to make sure that the resource that you're getting your information from is trusted and valid and accurate, because there's so much information out there that it's not always true. So yeah, definitely reach out to your pharmacist. And I know there's quite a bit in the industry. It's just right now it's still coming up. I'm sure if you put it in the Google search, you'll find something.
So, okay, here's another question for you. If you are buying a supplement, how do you know what you're really getting? You know what I'm saying? Like, how is there, let's say you need vitamin D, or, you want some like biotin for your
Turmeric.
skin, or, I mean, there's so many different products and things out there that will tell you that they can do all kinds of things. Like, how do you actually know what you're getting? Because that
You
feels scary to me.
Yes, and that's the thing, you don't know what you're getting, which is the scary part of this whole process, and why I feel we do need regulation, because there's so many companies out there. All the government is looking at is how their manufacturing is, but that's it. Um, which is very
And
scary. And that's why we've had a lot of situations where patients have taken products, natural supplements, and then ended up with horrible situations. Um, and death. So I don't want to scare people out there, but I want you guys to be vigilant about what you do get, and be knowledgeable that what you're getting is vetted and safe. And usually, so I always recommend people go from a trusted source, which they've know that have had studies done on them, or safety or efficacy reviews done on them, so that they know that it's actually the product they're saying it is. And I think that's the biggest thing. We don't know how that product is going to affect anybody, or if it's going to help or not. But what we can do is say, okay, is this product really ginkgo biloba? And is that what I'm taking? Or am I taking more than that, or not that at all? So I've heard of situations, and I know of situations where manufacturers claim that the product is ginkgo biloba, and it's not. It's rice powder or something else. And so that's kind of scary too. So it's very important to get a product that is USP labeled. So on that product, it will say, a little seal that USP. So that means it's been tested, and this is accurate and safe. And it says what it is, that it's known to have, let's say, ginkgo biloba in that
but
product.
does the USP seal help you know, like, they're testing to say, like, there is ginkgo biloba in here, but are they qualifying that the amount that's in there that they say is in there? Are they also doing that?
Yes, so they're also doing
Okay.
that as well. Yes. So,
Okay.
there's lots of products out there. So like if you go to Sprouts, you'll see tons of products at Walmart, Target, anywhere, um, with ginkgo biloba, and it's in 5 or 6 different manufacturers. You don't know which one to pick. It's overwhelming. So I would just, the best thing to do is see if they have that seal. If they have that USP seal on it, then you know that that's the product. The amount is true and it's been tested. So
Hmm.
that's why they put that seal on there, because of this whole, there's manufacturers out there that want to say we are quality product and we are delivering what we say we are delivering. Now I don't know about the claims that they'll make, but they can say promote, or support, um, some kind of issue. But really, um, each individual is going to have a different experience with that as well.
So we know that supplements aren't regulated,
Mhm.
but that doesn't necessarily mean that and we know that part of regulation involves a lot of research, right?
Yes.
That's how we define the basic efficacy of things, and yada yada yada. Um, but that doesn't mean that there is no research on supplements. Like, is there, just because it's not regulated, is there research that's out there and available for people to look at regarding some of the supplements that they might be interested in taking? That's a tough
Yeah.
question. Sorry.
Yes, no, and there is research actually showing that some herbs, vitamins, all of that, how it can be beneficial, and for what it's used for, and what results have shown for, healthy heart support or. Um, but it's very important also to see who is that research funded by.
Mm.
That's a huge thing because there is a lot of research out there.
Yeah, but it doesn't make it all good, right? Like, just because there's a lot of something, that you can find
Exactly.
information doesn't mean the information is good. It's the same thing with research. Is it high quality, or is this
Yeah.
terrible?
Exactly, exactly. So
Mhm.
having an independent research study done with, a good number of patients and for a longer time is more important to see than, oh, just a study. Oh, yeah, there was a study done and it showed this, but it had like 10 patients and it helped heart disease. I don't really believe that. And especially if it's funded by that manufacturer or a partner of the manufacturer. That happens as well. So you want to be very diligent and not always just fall for that. Oh yeah, there was a study. We don't know. So I always am cautious as well when it comes to looking at studies and research about the product. Um, Now we know vitamins are very helpful. Um, Especially when you're on medications or as you get older and you're not eating as well, or your metabolism decreases, you don't feel as hungry, all the different things combined with aging. So vitamins are huge and important. A lot of doctors and providers, and even me, we do recommend a multivitamin daily. It's For even if you're not aging, it's just a great supplement to add to everyone's diet. But again, making sure you're using the right multivitamin, and then looking at medications that you're on too, because um, if you're on a blood thinner and you're taking, a multivitamin that has vitamin K in it, it can contradict the effects of it. So we want to be diligent and aware of what we're taking, looking at what we're taking, and then make sure we have a seal or something that is recommended by someone who knows that this is a good product.
This feels very overwhelming and complicated. I mean, I'm just being honest. Like, first of all, we need to like pay attention to who makes it and if it's got a seal on it, and then we need to also like understand how to read research, right? And pick through like what's good research and what's not good research. And then we need to like make sure that all of the things that we are taking that are good, they all might be good individually, but together they might be counteracting each other. Even if it's not making you feel bad, they might make you not get the benefit that you need. So I'm saying all that to say, last time we talked, we spent a lot of time talking about how um, prescribed medication is not generally all of our first go-tos, and that we try to use more natural methods to deal with things at the levels that we have trouble with it. We know that there's clinical reasons for doing certain things, but maybe every time you have a headache, you don't necessarily take aspirin, right? And so my question is, in all of that long lead up, is it better, or how do you feel about like if I know that turmeric, for example, has anti-inflammatory properties and it helps with my arthritis pain, and I put it on my food, and then I see a turmeric pill and I say, oh well, more of it should be better, so I'll take it in a pill that's more than I can put on my food. Should we just like how should we think about that and incorporating like these natural elements that Eastern medicine does all the time um, into how we make our bodies feel?
Yes. That's a great question. And I think starting off with natural for prevention is a great idea. Um, and especially trying to get it from your diet. So if we can try to get what we need from our daily intake of fruits and vegetables and protein every day, um, I feel that that's a first step to a healthy lifestyle and getting all the nutrients, the vitamins that you need. Now, our bodies are, always talking to us and letting us know how we feel. So being in tune with how you feel, I think, is huge as well. So, um, the amount of food we eat, we know, okay, now we're full, we're going to stop eating. So our bodies are always telling us kind of, okay, this is what we need as an individual for ourselves. And we have cravings, and those cravings are also information trying to say we may need a certain nutrient. So I feel like, listening to ourselves, like when we're sick, we want hot tea or chamomile or ginger or something. And it's because our bodies are saying, okay, we need to increase our immune system. So I think in that way, that's a good way to first start. And then, um, you could easily add supplements in, again, making sure that they're safe, effective, and have the seal on it. But you mentioned adding turmeric to your food. Now, adding turmeric topically or in your food is not going it is a good amount for you. It's not going to harm you. It's not going to be toxic levels. It's not going to cause a problem. Now, let's say you're just like, oh, okay, now there's a supplement for turmeric, so I can just take that instead. And you go out and buy turmeric to add to your, intake. And now you may have more turmeric than you need. Turmeric is actually a very safe product. It's not really has much harm at all that I've seen in research. But for example, let's say if you did that with garlic, and you put garlic in your food, and they're like, oh, I heard garlic helps the heart and it's really good for blood pressure. And so I'm just going to go out and get a garlic pill. Well, we have seen that patients end up in the hospital with a ulcer, stomach ulcer, because the garlic is very acidic and caused erosion to the stomach lining. So, it's not always safe. So, again, speaking to your pharmacist or provider, letting them know what you're taking is huge. But yeah, so, prevention is great. And that's why my first suggestion would be is to find it in our diet, in our food intake. And try, supplements. And supplements are also great short term. The garlic situation with the patient that had too much garlic, um, and ended up with the ulcer was a long term, she was on it for over 6 months. So short term use of supplements is also safer than long term use and like extended forever amount of time. Because our bodies, we know intuitively and history, we don't eat the same thing every day. We don't have the same amounts of, food servings, or it's always changing for us. And so I feel like using our body as a guide to guide us in our cravings, in our hunger, satiety, I think that's a great place to start personally with supplements.
Well, this has been very interesting and eye-opening. I definitely learned some things that I was not aware of before. Like if I, need to take a vitamin or something like that, that I'm going to be looking for to make sure that what I'm getting is, hopefully more reliable. So thank you so much for being on today to discuss this very, very important topic. We'd love to have you back on again sometime because you're
Thank
so great.
Thank you. Thank you. I enjoy talking to you guys and love the questions, and they make me think, and I love that. Yeah, anytime.
Where where can people find like more from you, more of your wonderful education and information?
So,
And how to get their medications reviewed.
Yes.
yes. So my name again is Rashma. Um, do pharmacy consulting and medication management. And my website is wisemedrx.com, and email is reshma at wisemedrx.com. So if you have any questions or need a consult or medication or supplement questions, I am happy to help.
Thank you again so much for being here. Dear
Thank you.
listener slash maybe viewer, if you're watching this on YouTube, please take a second to subscribe, take a second to like, take a second to share this with anyone that you think might benefit from the information. And if you can, leave us a review, because that's one of the best ways for other people who might benefit from this information to find us kind of naturally and organically, is if we have good reviews for the podcast. So thank you so much for listening. Thanks for watching. And we'll see you next time right here on CareLab. Bye.
Bye.